Hello mga pangyaw! It's another great day and welcome back again to my channel. Na-miss niyo si Manay, no? Request to ng aking family and relatives sa probinsya dahil matagal na akong hindi nakagawa ng video. Busy kasi, masyadong busy na sa trabaho ngayon. So, ang isang letter sender natin nagpadala ng short letter. Ano daw masasabi ko sa ivermectin? Wala naman ako sa posisyon para magsalita niyan. Pero may isang doktor na yan na nagpatotoo. Ginamit na nila yan sa kanilang probinsya. Nasa page yan ng CDCPH. Yun, i-follow nyo, i-like nyo yung CDCPH. Marami dyan doktor ang tumutulong at dyan masagot ang tanong ninyo tungkol sa ivermectin. Okay? I-share ko ang video ni Dr. Jerry Kalingasan kasi siya yung doktor na ginawa na nila sa probinsya eh. Walang idea, walang sapat na kaalaman si Manay tungkol dyan sa gamot na yan. Kaya i-share ko na lang itong video ni Dr. Jerry nung nag-guest siya sa concerned doctors and citizens of the Philippines, CDC PH. Sila yung makasagot sa inyong mga tanong, ha? Okay? Ito, panoorin natin ang video nila.
Misamis Oriental slide. Speaking of Dr. Jerry Kalingasan, this is from Rappler. It says Misamis Oriental Health Chief. Okay, it's ivermectin use based on Duterte's statement. And it reads, the Health Chief of Misamis Oriental has authorized the use of anti-parasitic drug ivermectin on COVID-19 patients in the province based on President Rodrigo Duterte's recent statement that he has left the use of the drug to the discernment of patients and their doctors. Dr. Jerry Kalingasan, Misamis Oriental Provincial Health Officer, issued a September 15 health advisory and guidance directing public hospitals under the capital to add ivermectin to their COVID-19 treatment protocols. There are 8 public hospitals spread across Misamis Oriental under the capital. Of course, sumagot ka agad ang regional director. But let's hear it straight from Dr. Jerry Kalingasan. Good evening po, Dr. Jerry.
Sir Marie, good evening po. And let me take this opportunity to thank Dr. J. Del Mundo. When he saw my advisory, he called me up, and I was so surprised na he was able to contact me. So I'd like to thank him so much, and thank you so much also for welcoming me tonight in this group. And let me say good evening to Dr. Iggy Agbayani and Dr. Homer Lim. Si Dr. Homer Lim, I got his number from Congressman Marcoleta because I was supposed to call you up week ago or 2 weeks ago when I started telling everybody about this ivermectin news. This is not the first time that I've been telling my doctors to use ivermectin because actually we already have started, pero yung patago because that's the reality, that's true. So yun ang ginawa namin until sa time na nakita ko yung message ni President Duterte na yung sinasabi niyang discernment between the patient and the doctor. I was so happy when I got that. So I made that advisory immediately. And but ang sinabi ko naman, that depends on the doctor, but try to use it. And that advisory was supposed to be just for us, the doctors in the province of Misamis Oriental, but I do not know, it leaked out. Now, that is not the first time I also had an advisory, because even to our etong mga municipal health officers namin, I also gave them guidelines on how to use that ivermectin, and I did not even call it ivermectin during that time kasi I said off-label drug, but everybody knows that points to ivermectin, that off-label drug. And when that came out, Department of Health here called me up also because they were questioning me about that off-label drug. Now, this time, when my advisory was really very clear that it leaked out, the Department of Health called me again, and the bad thing was I was told na I created chaos and good. So I told him, I called him up, you better read and just don't open up your mouth or do something else. Now, if you do not read and if you do not know what the president have said. So sabi ko, pagalitan nyo ang presidente, huwag ako. Because the president said already. And then there was also that another thing, nagpapunta sila sa akin ng FDA. They gave me yung mga illegal, mga something like that. But on the third page, it was yung yung sa FDA naman was from March 15 and March 22 ng mga advisories nila. I think you know this.
Yes.
March 15 and March 22. And then on June 22, I think that was on June 22, the Department of Health made an announcement on COVID as long as it will be prescribed by a doctor. They also gave me that that copy, and I said, itong dalawa, si FDA and si Department of Health, I think, do not talk to each other because why did they give me this na kinukontra nila ako? But they gave me that announcement on the Department of Health na you can use ivermectin for COVID-19. So I took that. But deep inside me, I really said, what else can we give? We've been experiencing already a lot of deaths in the province of Misamis Oriental, na yung mga DOA, mga dead on arrival, tapos magtanong ka doon sa mga magtanong ka doon sa mga companion, sinasabi lang nila nga nag-SOB lang, ubo, nag-ubo, tapos SOB, and then that was it. So I said, we have to stop death. That is my greatest vision talaga, na you have to stop death. And what else can we do? So and what action can we do? I've been thinking about that. Na if I do not act now, more deaths will come to the province of Misamis Oriental, especially na talagang tumataas yung cases namin. We went up to more than 1,000 cases already, mga active cases. So when this COVID-19 started last year, wala kami, maliit lang kami. It all started with an ROF, and then doon na nag-umpisa ang cases ng Misamis Oriental. Now, another thing also I would like to tell you na the airport of Cagayan de Oro is in Misamis Oriental. So when we closed that airport before, I said na yung bababa sa eroplano, kailangan ng, it was first the antibody test, right? Mahirap pa noon ang RT-PCR test. So there was that antibody test. Now I told them na lahat ng bababa dito sa Misamis Oriental has to get an antibody test. Now, ang sinabi naman ng one of the personals of, they wrote me back, the Department of Health wrote me back, and they told me na that was next to impossibility. And now it's not anymore, it's not even the rapid antigen or antibody test, but it's the RT-PCR test. So yun, that came up to my mind when I said na I'm going to make an advisory to all the hospitals of the province of Misamis Oriental. We have 8 hospitals, and then 2 of them are repurposed already for COVID patients. Now, our referral hospital here, the Northern Mindanao Medical Center, which is just beside the provincial capital, does not accept patients anymore dahil punong-puno na sila. So kami, mga level 1 hospitals kami lahat, but we have repurposed 2 hospitals already as our COVID admitting hospitals in the province of Misamis Oriental.
Okay, si Doc J nagtataas ng kamay. Doc J, go ahead. Paki-unmute lang po, Doc. Paki-unmute lang. Doc,
You
pa-unmute.
can unmute na
Yeah,
tayo.
there we go.
Yeah. I really admire Dr. Jerry Kalingasan because when I read that advisory na ginawa niya nung September 15, ganun din pala the same date yung advisory of the Regional Health Officer, si Dr. Llacuna.
Llacuna.
Now, Dr. Llacuna, when I was Undersecretary of Health, was the provincial health officer of Camiguin. Kaya kilalang kilala ko siya because I went to Camiguin to explore it as an island for medical tourism. Okay, so anyway, sinulatan ko siya about this ivermectin, and I told him about the good job of Dr. Kalingasan, and sana gayahin niya, wag na niyang kontrahin yung Misamis Oriental Provincial Health Officer because he's doing a very good job. This morning, tinawagan niya ako. And sabi niya, "Sir, ginawa ko lang yon kasi I'm officer of the Department of Health." Sabi ko, "I understand. Pero kako, dapat we should think out of the box. Kasi kako, many are dying. This is a pandemic. This is not an ordinary disease." So sabi ko sa kanya, you should even commend Dr. Kalingasan because he's a very good, he's a model employee of he's not actually, the provincial health office is not part of the Department of Health because when the
Oh.
local governments were devolved, when the local government code was enacted, the provincial health office was devolved from the Department of Health. So technically, the Department of Health does not have any hold on the local government except in pandemics. But in Section 105, it only says that they can only manage the pandemic and order any actions only for 6 months.
Mm.
But the local government unit may extend it upon request to the national government. So it is more or less parang independent because the provincial health officer is the vice chairman of the provincial health board. So ganun ka powerful din ang provincial health officer. The provincial governor is the chairman, but the provincial health officer is the vice chairman. And all the functions related to health is devolved from the Department of Health. Meron lang silang mga representatives that they send to the provincial health office. Tapos meron ding counterpart ang provincial health office to the Department of Health. So Dr. Kalingasan was exercising his due diligence in terms of the practice of the management of this pandemic. So tama yung ginawa niya. And sinabi ko kay Dr. Lacuna, yung mga ginagawa ninyo, tigilan nyo na yan kasi hindi nakakabuti yan. In fact, gayahin ninyo si Dr. Kalingasan. Ikaw mismo, sabi ko, you will be a hero to the Region 10 if you also allow the use of ivermectin. Instead of sisiraan ninyo ang ivermectin, tagamit mo na yan, roll it out, distribute it to Region 10, and you will be a hero. Your cases will go down. So I salute Dr. Kalingasan. Thank you very much, Dr. Jerry.
Thank you, Dr.
Thank you
Jade.
also for that.
Sige po, go ahead po.
Thank you so much also Dr. J. Del Mundo for that, and thank you so much for calling also Dr. Boy Lacuna. And I just hope and pray na he changes his mind on what you have said to him, especially sana he will have some knowledge and wisdom to do what I have done for the province of Misamis Oriental. Magmayong gabi isad ako sa among kauban nga doktor here in Cagayan de Oro, Dr. Titit Lumikaw. I saw her name come out. Good evening po, Dr. Titit Lumikaw.
Oo. Kasi if he doesn't change his mind, magagalit si Duterte.
Oh.
Okay, Doc Homer.
Yeah,
Doc Homer,
so
go ahead.
hi, Doc Jerry. Hi. So, want to ask question. Kamusta po yung reception ng doctors ninyo in your provincial hospitals? What was their reaction?
Actually, I haven't talked to them since nagkagulo-gulo. But I've talked to the chief of our hospitals, and I told them na talk to your doctors of my advisory, because I'm really pushing it. And I've even talked to my governor yesterday because he was already asking me, because I've not talked to the media. The media was asking me. I said, I will not talk to the media, I said, because sabi ko, pag nagtanong sila ng question, they might be more intelligent than me. Yun ang sinabi ko po.
No, no, they might actually change the way you made the statement.
Yan ang problema.
Yun ang problema.
Sabi ko, the first question will be a question at my intellectual level. The next question might be higher than what I know or what I have not read. So I said, I
don't
will
think
not talk
so.
to the media.
I
So
don't
it
think
was
so.
my governor who talked to them yesterday. That's why there was an article that came out, yung kay Herbie Gomez. That was from my governor. That wasn't from me. So that was from him. Sige po.
Okay, bakit po ninyo napili gamitin ng ivermectin? There are other options there. Bakit ivermectin?
Actually po, I have read a lot before the CDC Philippines. I've been reading already. That's why I was telling the Department of Health, you read. Before telling me anything, you read first. And they were even asking me if I took already ivermectin. It was a very big yes when I told them. And hindi lang ako, marami pang, there are a lot of doctors here in Cagayan de Oro na I think they've been taking it, not think, but they've been taking it silently. At tapos, nagpa-prescribe ako through text kasi ang daming nagtatanong what will we do with these patients na hindi na namin pwede madala sa hospital kasi the hospitals are full. So I give them my yung mga protocol wherein doon ako nag-umpisa with FLCC, and then at the last is ivermectin. So that even went down to Bukidnon already. There was one doctor there na pag yung nakita niya yung prescription ko, I said, okay, I'll follow this because I know this doctor.
Wow.
So actually naman, we have started it also in our hospitals, in one of our hospitals na talagang we've been giving it already. So and then we found out also a good result na we've saved lives. That was the only thing that I was telling everybody na we have to save lives. We have to stop death. That is what I was always telling them, na you stop death in the province of Misamis Oriental. I didn't care if everybody gets COVID. Basta kay we save, nobody dies.
That's right. Okay, Doc, kamusta naman po yung supply ng ivermectin? Maganda po yung nagpe-prescribe or you're suggesting it for the province, but do you have enough ivermectin available in the province?
Yung prescriptions ko naman ay hindi tinatanggi ng mga drugstores dito. So that means to say there is a supply of
Alright.
ivermectin. Because I haven't heard anybody telling me na, Doc, hindi kami nakabili. I tell them, you go to these drugstores because they have this there. And they could even buy it in a cheaper price. And then there are also veterinarians here who have this ivermectin capsules of 15 milligrams.
Okay.
Doc,
Sige
one
po.
more question is,
Go ahead.
so are your hospitals full right now?
Yes. One big hospital of ours, they have gone up to 40% already of COVID patients. And then yung dalawang hospitals namin po na we have repurposed as COVID hospitals, punong-puno sila. They have ang capacity is 25 pero umaabot sila ng 40 patients. So we're
So,
really
Doc,
full.
Yeah. So, Doc, maybe you would like to push the envelope further. In other countries like in Costa Rica, in Paraguay, in El Salvador, they're actually giving ivermectin kits. So maybe that would be a good idea. Suggestion lang.
Yes. We will be doing that. We will be doing that. down to the barangays. You know what I did with the barangays today? What I did with the barangays, nagpa-survey ako. Nag-surveillance kami, di ba? We've been telling everybody na go on an active, intensified surveillance on ILI. Now, hanggang hanggang salita lang yun. Ang ginawa ko ngayon, ginamit ko si Department of Health on that active surveillance because they have all the nurses, the HRH and the NDPs in every barangay that we have in the province of Misamis Oriental. So, ginamit ko sila to do so that we will also have a good reporting on ILI. Actually, we did not have a good reporting on ILI. Now, we've started 2 weeks ago. So I said the early identification, early detection will go for an early isolation, an early quarantine, and an early treatment. And as what I have said, I've already given my guidelines to the municipal health officers. And part of that guidelines is already that ivermectin.
Nabanggit ni Big Tech sa comments. I mean, also mentioned the good governor of Misamis Oriental as he supported the decision of his chief health officer. Tama na po naman. Sinuportahan po kayo ng governor, no? Doc Jerry?
Yes po. Very much po.
Okay, sabi ni Virlog to Doc Jerry, kudos for a brave stand. Mabuhay po kayo, sabi ni Carbonell. Salamat, Jude Doc. Sabi ni Erwin, Imo Jude, gi-approve. Sana sa Davao City din approved. Ano kaya likelihood nun, ano? Sa Davao. Okay, good evening, Doc Kalingasan. Mabuhay kayo. Kudos, Doc. You're taking a brave stand. Kudos na naman mula kay Ronald. Murag, sabi ni Erwin, Murag, wala sila ga-follow man, Doc. Pakitranslate nga, Doc. What does that mean? Wala sila ga-follow man.
As if they did not follow.
Okay. Sa ospital, hindi kayo sinusundan sa ospital? Or the DOH did not follow? Okay, Doc Jerry, we're happy for you. Sabi ni Marlene from Cagayan de Oro. Thank God. Good evening po. April, nasa cdcph.org website. Ang dosage instructions natin, it's in the protocol section. No? If you go to cdcph.org, we'll show you the link later on in the show. You can read about the dosage there. Tapos si Leslie sabi, cheers and thank you, Dr. Jerry. Department of Health po, ang DOH, sabi ni Erwin. Hi, Doc. Merry Chris Vargas, thank you for the help. 2 friends recovered from COVID. Cheers to ivermectin. That's good to hear. Kudos to Dr. Kalingasan from TESB. God bless you. Thank you, Doc Jerry, for paving the way in Northern Mindanao. What do you think, Doc? Kakalat ba sa Mindanao ito dahil sa ginawa ninyo?
Yung nag-leak po ang advisory ko. It was even seen by Dr. Jade already. So let me say it's all over. So, the first thing I did was to look for kung sino bang nag-leak niyan, and my governor told me you cannot find them anymore. So all we have to do is we just answer their questions. So yun na pong ginawa ng governor po namin ng Misamis Oriental, si Governor Bambi Imano.
Okay. Sabi ni Eleanor, Doc, go ahead, Doc Homer.
We're happy that at least your governor is really supportive. We really need more governors and mayors to really support this movement, because this will really be the game changer for everyone. Thank you.
Doc Jade is a former Undersecretary of the Department of Health, Undersecretary of the Department of Health. So he can talk a little bit more about that, Doc Jade, if you would, about the evolution of the powers na would allow other doctors who are in a similar situation as Doc Jerry or maybe higher than him in position to be able to do exactly the same thing as Doc Jerry. Tama ba, Doc Jade?
Yes, tama yan. The local government physicians, the local government, health, no, from the provincial health office to the municipal health office, are already devolved from the Department of Health. Nagpapadala lang sila ng mga representatives para malaman nila yung mga recent directives from the national government with regards to, let's say, maternal care, communicable, non-communicable diseases, mga vaccinations, etc., etc. But they can actually perform on their own with regards to their whatever decisions they make are entirely of their own decision, no? Based on scientific evidence. So si Dr. Kalingasan was practicing according to his readings. Marami na siyang nababasa tungkol sa ivermectin and other management based on the FLCCC protocol. So yun ang ginawa niya to his best interest, to the best interest of the province of Misamis Oriental. Ginawa niya ang pinakamagandang palagay ko magagawa niya para maging effective yung kanyang position as a provincial health officer. So totoo nga naman, maraming natutuwa sa kanya at sabi nila marami na gumagaling at marami na prevent yung kanilang illnesses. So I just want to say na maganda yung example ni Dr. Kalingasan, and he can inspire other provincial health officers and even the regional health officer, si Dr. Lacuna, na sabi niya he's only following the directives of the Department of Health. Sabi ko, magbasa ka and you expand your mind, think out of the box, sabi ko. Mabuti na lang si Dr. Kalingasan is a good friend. I know that he's a good friend of the governor. Kaya pinapabayaan siya sa ginagawa niya, which is good. Kasi dapat ganon talaga ang relationship ng provincial health officer sa governor. So yung kanilang synergistic move was very beneficial to the province of Misamis Oriental. And I hope yung city din ng C8 ng Cagayan de Oro would benefit kasi nandun nakaupo yung regional health officer. Thank you.
Okay, may tanong dito si Paul. Sabi niya, can we have a copy of the directive of Dr. Kalingasan, please, for reference purposes? Baka nga pwedeng gamitin ng ibang regions ito, no? Ibang provincial health officer. Where can we find this? It's on Viber. Ellie or Boss Ann, can we put it somewhere?
We'll send the file here later, pero hindi siya masyadong clear. But it's also in the internet. They can Google it under images, nandun din siya. Kasi na-viral na rin siya.
Okay. The easiest one to do is to search for Kalingasan, Kalingasan,
And
or
Misamis Oriental.
Misamis
Yeah.
Oriental.